is two very important questions. The first one is a very good one because I know that all journalists, you are very curious about how is my country doing? He's the best country in the America, he's the worst. What is your assessment about this? Let me be very clear. We are not ranking the countries in the Americas. We are giving some best practices in very specific aspects. It's not the same to say that they are doing everything well, but in these specific topics that I have mentioned, and they are very important to improve the response, these countries are good examples, and we could have not 3 or 4, but 10 or 12 to share with you. Jamaica, I said that Jamaica, Costa Rica, and Argentina is doing very well in a very important point, that is to trace, to monitor the contacts that you have, because when you do that, you can reduce the spread of the virus, you can interrupt the chains of transmission. So Jamaica, Costa Rica, and Argentina, they are using their surveillance system to perform this very important task. And we are giving these examples exactly to call the attention of other countries to this very important aspect. But we are not ranking the countries. We are not saying that the countries that I mentioned are the best ones in the region. In these particular topics, and these are very important topics, they are doing well. So for this reason, we are recognizing them in order to share their efforts. All the countries are doing the best that they can. They have mobilized the resources. They are fighting against an unprecedented public health crisis. And in every country, for sure, we can have good examples and best practices that we will share in the future. About the second question, let me tell you, PAHO and UNICEF will be the procurement mechanism for COVAX. So it's not a parallel action. We are, with UNICEF, the purchase mechanism for COVAX. So in the next days, we, PAHO and UNICEF, we are releasing on behalf of COVAX the first official pre-tender for the vaccine. So we will receive information from the producers about how much vaccines and when they believe that the vaccine will be available and what is the cost. And with all this information, we will review them, and after these vaccines are pre-qualified by WHO, we will start the bidding process. So we are engaged with all countries in the region, and Jamaica is very active in this negotiation, as well as all the Caribbean countries, the countries in South America, in Central America. They are all engaged in COVAX facility, and we are participating in this facility, in this not only with the purchasing process, but also advocating affordable prices for the countries in the Americas. Thank you.
Gracias, doctor. Otra pregunta que nos llegó es de Linda Straker de Now Grenada. Dice, there is now community spread in at least 2 regional OECS territories. What advice will you give to governments and people in the CARICOM region experience outbreaks? The Caribbean is dependent on tourism. How does PAHO view the current protocols for entry? Dr. Aldigueri?
There are a couple of questions within the same question, I think. So I will do my best to address these questions. I'd like first to explain the way that countries and territories of the Caribbean are reporting to PAHO using PAHO WHO guidelines. That there are 4 types of transmission that the countries do a joint assessment with us. No case, sporadic cases, cluster of cases. It means cluster. It means that the surveillance system knows what is the chain of transmission, and community transmission. So at the moment in the Caribbean, we have really very different mosaic of different patterns of transmission. including the countries of the mainland, Belize, that is more related to the dynamics in Central America, Suriname and Guyana, that are more related to the dynamics in the Amazon basin and other countries of the mainland, and the Eastern Caribbean countries. In the Eastern Caribbean countries, community transmission has been reported in French departments and Dutch territories. The English-speaking countries and territories report on no cases during the last weeks, or sporadic cases, or clusters. So the main advice to the countries that at this moment are experiencing clusters of sporadic cases is to be ready and to implement very strong contact tracing activities linked to a strengthened surveillance system, including the laboratory. Most of the countries of the Eastern Caribbean have now national laboratory capacity, and those with no capacity have the option to refer the samples to a Caribbean Public Health Agency. Regarding protocol for entry and testing before travel and testing after arrival, I will link my answer to what I already said with the antigen test, is that PAO does not recommend the use of laboratory protocol for deciding regarding at point of entry. We recommend the very comprehensive health monitoring of the travelers for non-essential travels, and really the laboratory based protocol gives a false sense of security to the countries. Again, this is at primary healthcare level. This is part of strengthened primary healthcare networks that the battle would be won by the countries in a Caribbean context and also other context. I hope I have answered the concerns of the journalist. Thank you.
Gracias, doctor. La siguiente pregunta nos llegó de José Carlos Cueto López de BBC Mundo. Sobre la vacuna también dice, ¿cómo se está preparando el continente, sobre todo zonas rurales, para almacenar y transportar una potencial vacuna? ¿Y está actualmente lo suficientemente preparado el continente para este desafío? Doctor Barbosa.
Gracias por la pregunta. De nuevo, esa es una de las 10 vacunas que están en la fase 3. Hay un anuncio por parte de la empresa productora hace algunos días que están ya con datos preliminares, y subrayo preliminares, que tienen una buena eficacia. Todo eso primero tiene que concluir, publicar los resultados, presentar el dossier para que se pueda tener una evaluación. De las 10 vacunas, 2 son vacunas muy novedosas, inovadoras, que no hay otra vacuna en uso, que son las vacunas de RNA. Essas 2 vacunas van a requerir el almacenamiento y el transporte a menos 75 grados Celsius. Las otras 8 se pueden manejar con los estabelecimentos que tenemos hoy y las condiciones de almacenamiento. Pero mira, no es solo áreas rurales. Las áreas rurales urbanas de ningún país del mundo hoy están listas para manejar esa vacuna. Entonces, el productor informó también hace algunos días en una reunión que tuvimos con ellos, que están desarrollando equipos más pequeños para mantener durante el transporte. De nuevo, el almacenamiento y el transporte tiene que ser a menos 75, pero en las unidades de salud, donde se utiliza la vacuna en cualquier parte, se puede utilizar el mismo equipo que tiene hoy, porque la vacuna puede ser almacenada hasta 5 días en la temperatura de 2 a 8 grados, que es la temperatura común que se utiliza para vacunas. Entonces, ¿quién está preparado en el mundo? Nadie, porque esa es la primera vacuna que tiene essas características. Pero hasta a vacuna estar lista, disponível com as outras vacunas, os países vão tomar suas medidas para fortalecer, para reemplazar, para adquirir novos mecanismos e novos equipos de almacenamento e de transporte para que estén listos. Hoje, nadie está em áreas rurais e urbanas de nenhum país do mundo, mesmo os países mais ricos. Gracias.
Gracias, doctor. La siguiente pregunta nos llegó de Michael Clocks de Depictions Media y dice, with mental health issues on the increase with the pandemic, how can families ensure family members with mental health conditions are receiving proper treatment? Doctor Ugarte?
Thank you, Michael, for the very important question, because mental health is one of the aspects of the COVID-19 that we don't pay enough attention, and actually is more common than we expect. As it happens in any emergency, in large disasters, for example, approximately 25% of the population affected may need at certain point some support on mental health. Regarding the persons who a family member with mental health condition, you have to make sure that the person with a mental disorder or treatment continues the treatment as being prescribed. So you need to ensure that you have enough stock of medication. For example, have at least 1 month of stock of medication. Avoid treatment disruption, because treatment disruption, of course, may cause the patient to present some of the symptomatology, and also may have a risk of relapse of the situation, of the condition. Continue also with the consultations with the health provider, researching also professionals that are close and probably the ones that are providing this support through telemedicine, telemental health, and protect the mental health also of your family, yourself, and procure not to be, try not to be isolated and interacting with others, you know, and trying to maintain the physical distancing, but with no social distancing. You have to maintain this, for example, proper diet, sleep, and exercise. When we say maintain the contact with families and friends virtually, and also reduce the consumption of alcohol. And in cases when there are emergencies and other situations, that adversities, use those skills and the practice that you use to overcome those adversities also in these conditions. And because the information sometimes is not accurate, and sometimes the information may create more anxiety, try to look at the information from trusted sources, but do not stay longer time looking for that information, because it may also cause some anxiety. And at all times, try to maintain the healthy situation of all the family, particularly the elderly people, the people that cannot take care of themselves, and children and adolescents. Thank you.
Muchas gracias, doctor. Otra pregunta también vinculada con vacunas, que bueno, más o menos ya hemos contestado, pero si sigue habiendo algunas dudas, de Alina Dieste de AFP, también dice que Pfizer generó mucha esperanza al anunciar resultados positivos para su vacuna contra la COVID y quiere saber qué significa esta vacuna para América Latina. Doctor Espinal, quizás pueda contestar esta pregunta.
Gracias, Alina. Siempre es muy buena noticia tener esperanza de que la vacuna de Pfizer es efectiva como se ha anunciado, en un 90% de eficacia. Y esperamos que otras también puedan ser anunciadas pronto, como ha dicho el doctor Barbosa. Hay unas 10 ya en ensayos clínicos de fase 3. Pfizer está haciendo acuerdos bilaterales con países y en América Latina ya tiene acuerdos con Argentina, con Chile, con México, Ecuador, y está negociando también con Perú y Brasil, ya que los países tienen posibilidades de acuerdos bilaterales o a través del multilateral con el COVAX, la OPS y el Fondo Rotatorio. A lo que no nos oponemos porque cada país es soberano. La ventaja a través del COVAX es que hay una serie de vacunas que van a estar disponibles, de todas las que tiene COVAX en su portafolio. Cuando se hacen acuerdos bilaterales, son buenos también, porque si se hace un acuerdo para la vacuna que muestra ser eficaz, perfecto. Pero en otros casos puede ser que no sea eficaz. Pero en este caso, los resultados de Pfizer son muy prometedores y como ya explicó el doctor Barbosa, el problema, la cadena de frío a menos 70 grados, pero la OPS siempre trabajará con los países para asegurar de que la vacuna que sea, independientemente cualquiera que sea, pueda llegar a las poblaciones de nuestra región. Es una buena noticia y esperamos que otras también se unan a esta posibilidad. Hay que esperar también los resultados, porque también como los anticuerpos, los cócteles, son resultados preliminares y Pfizer no ha terminado tampoco el ensayo clínico, todavía no está aprobada de emergencia, así que las próximas semanas van a ser interesantes y esperamos que otras vacunas también puedan ser anunciadas. Muchas gracias.
Gracias, doctor Espinal. Estamos llegando ya al final de esta sesión informativa. La última pregunta que tenemos por hoy dice lo siguiente. What should be done to ensure that those with underlying conditions, such as diabetes, can avoid complications related to COVID-19? Doctor Barbosa.
Well, thank you for this question. This is a very timely question because next 14th of November is the World Diabetes Day. There are currently 60 million people living with diabetes in the Americas, and even before taking into account the additional risks posed by COVID-19, diabetes that is not well managed can lead to blindness, kidney disease, and even amputations. COVID-19 pandemic has certainly posed an issue to those managing diabetes and other chronic conditions, including the cancellation of routine hospital visits, issues receiving sufficient medication, particularly during the implementation of public health measures that were necessary to reduce the spread of COVID-19, but posed this additional burden on people with some underlying condition. PAHO is working with our member states, the countries in the Americas, to ensure that the care for chronic conditions, including diabetes, remains available during the pandemic. This includes offering care outside traditional settings and ensuring that medicines such as insulin remain accessible and affordable to those who need it. Patients must also be provided with information so that they understand their risk and have access to the necessary tools to manage their disease. This is very important for us, that the countries can, first, they need to use the primary healthcare system that they have, because this is the best way to be closer to the communities, to offer access to diagnosis and treatment for diabetes and other chronic diseases, and also to move for a broader use of new technologies, new platforms, cell phones, telemedicine, teleconsulting that can reach out to people in vulnerable situations. So this is a very important question, because COVID-19 is an unprecedented public health emergency, but we also have people with diabetes, with cardiovascular diseases, that they have an increased risk for severe conditions, so we cannot forget them. They need to be at the center of our response in every country in the regions. Thank you.
Muchas gracias, doctor Barbosa. Ahora sí, entonces hemos llegado al final de la sesión del día de hoy. Les vamos a compartir nuevamente la página web de la OPS, donde pueden consultar las actualizaciones regionales sobre la situación epidemiológica, y en breve les estaremos enviando por email las palabras de apertura del doctor Barbosa, así como la grabación de esta sesión. Disculpen para los que no llegamos a tomar sus preguntas hoy, pero como saben, siempre quedan, también nos quedan para la próxima semana, pero si necesitan una respuesta más inmediata, nos pueden contactar por correo electrónico que les estaremos contestando. Así que gracias a todos nuevamente y hasta el próximo miércoles. Saludos.